good morning, everyone. It's a true pleasure to join you at the 7th summit of SCOHRE. Well, it was much better when we could have met in Athens as usual, face-to-face, but it's also fine to be online. And thank you for joining us for this morning talk. Let me have my slides. The question I was asked by the organizers how to price your lifestyle. It's the first question is our lifestyle priceable? So is it transferable into numerical values or numbers or amounts of money? But you know, the question asked, it had to be answered. Before, let me show a conflict of interest. None of the conflicts addresses the lecture today. Well, let's start with the genesis. So where are I coming from? Unde venimus? This is the question that the mankind is asking itself for a million years. And when we look at that, it's no matter where we're coming from, the number of people living worldwide is increasing. At least it's increasing until now. We now here somewhere in 2023, 2024, and we exceeded 8 billion inhabitants of the Earth, which some of the scientists active in this field say is the maximum, and from now on, some of them project that the number is gonna get lower. But when we look specifically at the different continents, we see that the number of people will keep the value in Asia and still increase in Africa, while decreasing in Europe, Northern Africa, and South America. Well, the question would be why? What's changed? Well, looking from the public health point of view, I'd say that the risk factors of premature death or risk factors of chronic disease development have changed in the past 50 or 70 years, and they have changed dramatically. We know that the classical, traditional risk factors were undernutrition, indoor air pollution, water, well, lack of pure water, lack of sanitation, and very low level of hygiene. And still, these risk factors remain leading ones in some parts of Southeastern Asia or in parts of Africa. But just let me remind you from the previous slide that these regions are those that will keep increasing by the number of inhabitants in the coming 50 years, while the other regions like Europe and Northern America will not. And the risk factors in Europe and Northern America have changed absolutely. The undernutrition or lack of pure water, drinking water, is a secondary problem, but the primary problems and the primary risk factors for us are the tobacco smoking, physical inactivity resulting in overweight, junk food, adding up to the physical inactivity, resulting also in overweight, urban air quality. So it's not indoor air pollution, but rather outdoor air pollution that's now among the leading factors of chronic diseases. And we have also occupational risks that have been unknown and I've heard of still 50 or 60 years ago. Of course, we need to remember that some of the risks we are exposed to are modifiable and some are not. Today we'll focus on the modifiables, so those that create our lifestyle, because let me remind that the first question asked, is our lifestyle priceable? So how can we price our lifestyle? So the lifestyle contains also so-called modifiables or behavioral risk factors, including smoking, alcohol use, physical activity. Well, inactivity as a bad thing and activity as a good thing, and diet. Diet that is very imbalanced, and that I mentioned also the risk factors, saying that the diets of junk food and lack of fresh food and healthy diet leads us to obesity and several diseases. When we look at the numbers, because when we have to numerically address our lifestyle, we see that the risk factors that are the most important ones, they are on the left-hand side of the slide, starting with tobacco, with the indoor, but mostly, as I said now, outdoor air pollution, with bad diet and alcohol use. These 4 or 5 factors listed are responsible for over 20 million premature deaths all over the world, with 17 million people dying, and their death is attributable to cardiovascular diseases. So no matter how we look at that, the CVS are the leading causes of premature deaths, and the CVS and cancers are mainly caused by tobacco smoking and the outdoor air pollution. Looking at what we've learned about the risk factors and the diseases in the past 50 or 70 years, WHO suggested the 5x5 approach. So naming 5 major risk factors. They're all listed here in the lower row. I will not repeat them because I already introduced them during this presentation. And 5 major diseases, I'd rather say groups of diseases responsible for the shortening of life, for the decreased quality of life, and partially responsible also for that the number of people, that the number of Earth's inhabitants stopped growing, especially in let's call them old continents like Europe and Northern America. So of course this is not the only reason, but one of the reasons of this inversion in population dynamics is the number and the dissemination of these 5 major group of chronic diseases that are responsible for almost 90% of premature deaths all over the world. Well, although a high percentage of this death occurs also in underdeveloped countries or lower to middle income countries, but the problem is that in wealthy countries, they account for like 90 or 95% all premature deaths, which is a really very big problem. Yeah. When we look at that this way, economically, so trying to price the lifestyle, when we look at the NCDs, so the NCD, non-communicable chronic disease, from a point of view of an economist, has 2 outcomes. One of them, well, it's influencing the labor. The amount of labor that the person suffering from NCD can perform is limited. So the output level of labor is lower. The capital that the person has and can invest is also limited, so it's lower. So both these factors sum up in economic output, well, just countable. It's already not a risk factor. It's already not a way of living. It's already not NCD. No, it's at this point, it starts to be a countable and priceable thing, namely lost output, loss in the, well, private economy or loss in world economy, just because we are getting sick with NCDs, especially the 5 groups named. Please have a look at the middle circle here in this slide, and we see that, well, in pair, that cardiovascular diseases are the major killer in our world. They're also producing the highest decrease in in labor inputs, in labor outputs in patients suffering from NCDs. Also, when we look by the income category, we see a very similar dependence that we see in the percentage of NCDs in the society. I mentioned that in wealthier countries, NCDs are responsible for 90 and over 90% of all premature deaths. And also in the same group of countries, they are responsible for at least 70% also lost financial output. So when we look at some projection, the projection was made a decade ago, so it ends up next year, but still we see that in this decade, all the countries lost almost $7 trillion. Well, of course, prevailing upper middle income countries, according to that, they suffer in 70%, and following closely those with middle income. So the first thing I want to ask you to take home is that our lifestyle is not only destroying our health, it's not only creating or putting us into bed with the chronic disease, but this lifestyle results also in financial losses and the lower development or lower prosperity of the economic system that we're all part of. Well, so having said that, and presenting where are we coming from and what we did so far, let's see where we are now. So ubi sumus, where we are at present. Well, at present we know, and it has been also published a while ago, that preventing or improving lifestyle, preventing unhealthy behaviors, starting from cigarette smoking, then going to unhealthy diets, alcohol drinking, lack of sports, and so on and so forth. Investing in that, so trying to change the bad habits into good, pro-healthy habits, can earn us money. Simply investing $1 at 2015, by 2030 should return with over $7 spared money. So the revenue is 700%, which is unbelievable. Well, I wish being sometimes in the active in the Polish bourse that the market was 700% up and it was stable, and I could cash it after the 10 years. Well, good wishes to all who invested in the health. The problem is that even though we know already, it has proven and reassured after 3 years by WHO that really this savings will occur in every economic system, we do not still invest in this economy system, and investing in the health prevention system. And investing in health prevention is a very simple thing. Simply, we need to convince every single person, starting from early childhood, ending up at adultness or even at older age, that either he or she shouldn't start bad habits, or he or she should leave bad habits as soon as possible. When you look at this graph, we have a person smoking. Every cessation of smoking, so every quitting of the bad habit, well, decreases the risk of NCDs. And as I already demonstrated, NCDs end up with financial losses. So preventing NCDs builds up the savings. So when we invest $1 For cessation of smoking at this point, we can expect after 15 years, as I showed you, $7.50 saving in the healthcare system. Of course, we are not that successful that we can ask or cause everyone quit smoking, quit drinking, quit using excessive amount of sugar, salt, and so on and so forth. But we can have this 100% effect in some of the people, and in some other, we can at least convince them to switch to less risk or modified risk products. We have such products in the alcohol market, in tobacco market, we have sugar replacement products. So in every single part of the market, for every single unhealthy behavior or for every single unhealthy used substance, we have some replacement, which will not be as effective for health as total cessation, but still it will be better than staying and continuing the ongoing habit. Well, but when we look at those who didn't want to cooperate, who never quit or reduced the harm, so we mostly have no gains, but we have losses. Losses as direct cost of the diseases, which are very simple to name. These are, well, medical expenses, these are pharmaceutical expenses, this is medical staff, keeping hospitals, and many other that we know, because when we're sick, we need immediate help. And these are direct costs of helping those who became sick, who have NCDs, because of the unhealthy habits they had. But this is the iceberg phenomenon, well quoted many times in economics. Not only, I would rather say by 20 to 80 is a Pareto rule, showing that the 20% that we see and we say they are so immense, they are only the tip of the iceberg, and the rest of the iceberg are the costs that we do not see, especially loss of productivity, shortened lifetime. This is what we started with. Low morale, because we feel bad. We have bad quality of life. We know that we are sick. We have an NCD, practically a treatable condition, but everlasting condition. So all the bad things go into this 80% of costs that we do not see for every day, but everyone who is active in public health or health system financing perfectly knows what these costs are and why they're so powerful. Well, this should cause us investing in health, especially in prevention. When we look at the graph here, we see that investment in prevention, on prophylaxis on every level, well, differs very between countries. Leading Canada spends almost $300 per year per person for prevention, well, while Latvia and our today's host, Greece, spend around $30, so tenfold less for the prevention. Does it really influence anything? Well, let's see. We have Norway spending $160, and we have Poland spending around $40, so fourfold difference. What does this money go to? So it goes really this small fraction that we believe go to the prophylaxis, to the prevention, it's still subdivided. And really, for the real prevention and prophylaxis, goes only, well, let's say 30% of this. Does it have make it any difference? Yes, I just chose the two countries. Norway spending, let me remind you, $160 per person per year on health promotion and prophylaxis. and Poland spending $40 a year on the same. And now we see smoking in Norway. This is, well, just 12%, while in Poland, 20%. Dietary risks, well, 13 to 20. Every single risk factor that's responsible for the NCD development, so for the future losses in economics, is much more present, much wider present in Poland than it's in Norway. This is a pure effect of the money spent on prophylaxis, prevention, and health education. So it really pays off. It's really this graph I showed you from WHO saying that an investment in public health, in prophylaxis, pays off. Well, but it pays off in 10, 15, or 20 years. When we look at Poland, that, as I showed you, spends very little for public health and prevention. When we look at the year 2000 and the year 2021, trying to compare the amount of diseases, so the presence of chronic diseases in the society, and when we look at the ischemic heart disease, both 25 years ago, well, 20 years ago, and 2020, so it's a 20 years time span, we see that the difference, although visible, it's not very big, which says that really the prevention doesn't work good. So we do not know how to spend on our lifestyle to have better life quality, and still earn money, or at least save money in the future. So not knowing that, where are we going? Quo vadimus? Where are we going? So where is our future located? The health future, of course, because the humanity future, as I showed you, the decrease in population of Europe and America, well, are already visible and will be increasing in coming years. So once again, the 5 risk factors and 5 diseases. Let me focus especially on tobacco use as a risk factors for 2 reasons. First of all, SCOHRE is the organization looking mostly at tobacco use and harm reduction in this field. Secondly, in my opinion, tobacco use and cigarette smoking is a very specific risk factor. First of all, because it kills over 8 million people a year all around the globe, which means it's the biggest killer among the risk factors. It does also affect, and it does also kill non-smokers. So the effect of secondhand smoking is visible, and amongst those 8 million dying from cigarette-related diseases, 1 million are second-hand smokers. And the third very important thing is that the addictive substance nicotine in a cigarette is not the major harmful part. So it addicts, but the major harmful substances are absolutely other. Well, when we look at the effects of a global fight against cigarette, so we see that in the past 15 years, there is not much change in the amount of smokers, 1.1 billion into 15, 1.3 billion into 23. So we can rather say that the amount increase. Of course, these are absolute users, not only cigarette smokers. And we can say that, well, there is some success in many countries like Sweden, Czechia, maybe even the United States or Great Britain, but these are local successes. And they are, if we look at this in the world perspective, we see that the number keeps the same. So when the number of smokers decreases in the country I just listed, it does increase in other parts of the world, especially as we see here, China, India, Indonesia. These are the new islands for cigarettes. So it shows that the global policy of WHO fighting cigarettes, it's not very effective. We should rather, in my humble opinion, concentrate on the way that the country that were more successful than the average in the world, on the way that they went. And these countries, what we'll discuss in the panel that follows this presentation, these countries went the very well organized and very well planned and programmed path of prevention, starting the medical education, ending up with harm reduction. So all the levels of prevention have been employed to produce the success. So the lifestyle has been changed, but also the effect of poor or bad lifestyle have been addressed. Exactly a year ago, well, maybe not exactly, it was June 2023, I've been asked to give an opinion to our parliament, the Office of Analysis of the Polish Parliament. And the question was about question about the situation of nicotine dependence and cigarette epidemics. Well, it's not a time and a place to present my whole report, but one of the data I want you to look at is the years life lost. The YLL, it's the acronym of years life lost, attributed in Poland to cigarette smoking. Please, when we look at the 4 major groups of diseases, ischemic heart, strokes, lung, bronchial cancer, and COPD, so chronic obstructive pulmonary disease, and we sum it up in 2 age groups, so the younger and the older ones, we see that totally, cigarette smoking in Poland is responsible for over 550,000 life years lost. So looking at that, we can say that eradicating cigarettes will save these years. I showed you at the slide with intervention that, of course, the eradication, quitting, is the most effective way of influencing hygiene of life and influencing lifestyle. But those who are not willing to quit or cannot quit for some reason, well, it's also good if they change to less harmful methods. This will not get us to 100% effect, but this will be a better situation that we have now. When we're talking about harm reduction, we have all these bad discussions about harm reduction in a single person. Is it possible for the cigarettes or, cigarette-like products, or is it not? Well, for this, I would suggest, we'll come back to this in the coming panel, I would suggest that we make some international, public-financed and publicly driven research that finally answers the question, because, we can say, the purists say, okay, no, there is no harm reduction effect. The pragmatists say, if these products have less harmful substances, they must be less harmful in the real life. So we have the 2 groups discussing. Let's do it finally good and make a trial. But when we're talking about the population harm reduction, it's much simpler, because we calculate it very simply. We take the product risk reduction and the prevalence of this product, and then by multiplying, we see how much population is being harmed by this product. Then cutting down the product by 10%, 20%, 30%, we see how much of this population harm can be reduced. Well, this is not my idea. This is taken from the official site of FDA, government side of the United States government. What we know for sure, and even if we do not agree upon the harm reduction level, we absolutely agree for the economic value of lifestyle. So the economic losses of smoking, of cigarette smoking itself, is about 2%, 1.8% of GDP in a global perspective. So almost 2% of whatever is added to the GDP globe-wide is being lost because of cigarette smoking. This is a huge price. Of course, much bigger price is the lives lost that I just showed you in Poland. But this is also a huge economical price that we have to pay. Well, it's well understood and well established that, look at this graph, the assumption was one: we do not change anything in lifestyle, we do not change anything in the healthcare, we just make people stop smoking from now on. Today, everyone in the world who is smoking quits smoking. Then what happens? After not even 15 years, we see the reduction of costs of 10%. And now in this graph, we have a prolonged survival by 3 to 5 years, only because the entire population quitted smoking. Every single person in this globe lives 3 years longer. 3 years, we are 8 billion, so we're talking 24 billion years added yearly. Wow. Let me remind you that the Earth itself has only 5.5 billion years. Okay, I said that there are those who are objecting such an attitude. And hey, well, to agree, I'm the pragmatist. I'm not a purist. I believe that the harm reduction really is, but we need to say finally how much and at what points it works. For this, I would suggest it's also not only my idea. This is also taken from the FDA page, and it gives us step-by-step procedure how to obtain public results, publicly acceptable results, to say, well, are any products less harmful than cigarettes, or there are no such products? And this will finish up the discussion, and this will finally allow us to go the way less harm, less tax, and many other things in public health are dependent on the final answer to this very question. Well, going to the conclusions, NCDs are the main product, if I may say so, of unhealthy lifestyle. There is 41 million deaths from NCDs, premature deaths each year all over the world, and the number is expected to increase sharply, reaching over 50 million in a half decade, so in 5 or 6 years. And the costs of this disease is 47 trillion for 20 years, so roughly $2.5 trillion yearly. NCDs are the most expensive, therefore, in interventional medicine, and this is money that is being spent just because of the lifestyle. So this is how much our lifestyle costs us: $2.5 trillion a year, only cigarette smoking. Due to addictive nature of some factors in smoking, drinking, sugar eating, giving up these bad habits is difficult or even sometimes impossible. Hence, at this point, we have the role of harm reduction techniques, but we need to finally prove the effectiveness of some of them just to stop the discussions, and for which we are only losing time. Investing in the prevention and eradication of risk factors is the most viable program from both economic, well, both any economic, health, or social perspective. Well, I'm sorry, I took 7 minutes longer. Thank you very much for your attention.